Hello, this is Nursing School. My name is Patrick. This is second video in 5 video on the content of nursing process. Let's start together with the second step is diagnosis. Diagnosing phase. Diagnosis. The second step of nursing process, this step consists of, to analyze data, to identify client's health-related problems, nurse analyze data and identify one or more nursing diagnoses. Main activities in diagnosing phase are, analyze data. Identify health problems, risk, and strengths. Formulate diagnostic statements. Purpose of diagnosis. The main purpose of nursing diagnosis is to identify, 1. Actual and potential problems. 2. Factors that contribute the problems, etiologies. 3. Strengths the patients can establish to prevent or resolve the problems. Nursing diagnosis. North American Nursing Diagnosis Association, NANDA, defines nursing diagnosis as a clinical judgment about individual, family or community responses to actual or potential health problems or life processes. A nursing diagnosis provides the basis for selection of nursing interventions to achieve outcomes for which the nurse is accountable. In 1990, NANDA defined nursing diagnosis as a health issue that can be prevented, reduced, resolved, or enhanced through independent nursing measures. Nursing diagnosis provides the basis for selecting nursing interventions to achieve outcomes for which the nurse is responsible. Categories of nursing diagnosis. Nursing diagnosis are categorized into 5 groups: 1. Actual diagnosis, 2. Risk diagnosis, 3. Possible diagnosis, 4. Syndrome diagnosis, 5. Wellness diagnosis. Actual diagnosis, a problem that currently exists. Example, ineffective breathing pattern related to chest trauma as manifested by dyspnea, respiration rate of 26 cycle per minute. Risk diagnosis, a problem the client is uniquely at risk to develop. It is supported by risk factors that contribute to increased vulnerability. Example, 1. Risk for imbalanced fluid imbalance related to chronic diarrhea. 2. Risk of infection related to compromised nutritional state. Possible diagnosis, a problem may be present but requires more data collection to confirm its existence. Example, possible fluid volume deficit related to frequent vomiting for 3 days and manifested by increased pulse rate. Wellness diagnosis, a health-related problem with which a healthy person obtains nursing assistance to maintain or to achieve higher level. Also referred as health promotion diagnosis. Example, potential for enhanced balanced nutrition. Syndrome diagnosis, cluster of problems predicted to be present because of an event or situation. Example, rape trauma syndrome related to anxiety about potential health problems and as manifested by anger, genitourinary discomfort, and sleep pattern disturbance. Collaborative problems, they are physiologic complications whose treatment requires both nursing and medical interventions. Collaborative problems are managed through the use of interventions prescribed by other healthcare practitioners and nurses. They include those conditions in which the nurse seeks medical input for treatment of potential medical problems. Collaborative problems begin with the label potential complication followed by the situation, for example, potential complication, hemorrhage. Nursing diagnosis focuses on the response's actual or potential health problems or life processes, while medical diagnosis focuses on the illness, injury, or disease process. Nursing diagnosis changes as the client's response and the health problem changes, while medical diagnosis remains constant until cure is effected. Nursing diagnosis identifies situations in which nurse is licensed and qualified to intervene, while the medical diagnosis identifies conditions the healthcare practitioner is the licensed and qualified to treat. Components of a nursing diagnosis. A nursing diagnostic statement have 3 components. A problem and its definition, name of the health-related issue or problem or response for which nursing care is given. B. Etiology, its causes, related factors or risk factors. C. Defining characteristics or its manifestations, signs or symptoms. Qualifiers, Qualifiers are words that have been added to some NANDA labels to give meaning to diagnostic statement. 1. Risk for, used for risk diagnoses. 2. Potential for enhanced, wellness diagnoses. 3. Ineffective, not producing the desired effect. 4. Impaired, made worse, weakened, damaged, reduced, deteriorated. 5. Deficient, inadequate in amount, quality, or degree, not sufficient, incomplete. 6. Altered, 7. Imbalanced, 8. Inadequate. Diagnostic process. Consists to use of critical thinking skills for analysis and synthesis of. The diagnostic process has 3 parts: 1. Analyzing data, 2. Identifying health problems, risks and strengths, 3. Formulating diagnostic statements. Statements. 1. Analyzing data. Nurse draws on knowledge and experience to compare data to standards and norms and identify significant and relevant cues, identify gaps and inconsistencies in data, identifying health problems, risks and strengths. After analyzing data, nurse and client together identify problems that support tentative actual, risk, and possible diagnoses. Nurse analyze and determine whether the client's problem is a nursing diagnosis, medical diagnosis, or collaborative problems. Nurse and client establish the client's strengths, weaknesses, resources, and abilities to cope. Formulating diagnostic statements. Nursing diagnoses are written as 1. Basic 3-part statement, problem plus etiology plus defining characteristics. 2. Basic 2-part statement, problem plus etiology. 3. 1-part statement, problem only. 3 parts. Nursing diagnosis is written in a format called PES. P stands for problem, E stands for etiology or cause of problem, S stands signs and symptoms of problem, PESFORMAT. 1. The name of the nursing diagnosis is linked to the etiology with the phrase related to. 2. The signs and symptoms are identified with the phrase as manifested by or evidenced by. 3. Basic 2-part statements includes the problem, statement of the client's response or health problems, and etiology, factors contributing or probable causes of the response. 4. 1-part statements include on the problem. This format is mainly used for wellness diagnoses and syndrome diagnoses. Thanks for following nursing school. My name is Patrick. This video is second in 5 video. Let meet together in next video. Please subscribe, like and share and leave with comment.